getting ready here. So I've saved the best for last. This is probably all that you're really interested in are the sexually transmitted diseases. Yeah. Now I'm not going to show. If you want to, I'm not going to show very many graphic pictures. Okay. So you can go to the book for details on that. All right. So. I do want to describe some examples just to give you an idea of how these diseases get transmitted and some of the issues that are involved with these diseases. So I'm going to go through some of the more well-known examples, just to show you what kinds of symptoms there are. Now again, since we're talking about STDs, they often have, as you go through the different diseases, you'll find they have similar symptoms, right? Because they infect the same parts of the body. And so it does make it a little bit of a challenge to tell which disease a person has. Also, because we're dealing with male and female, often these diseases have different outcomes depending on whether you're male or whether you're female. So, for example, one disease may not cause many symptoms in a woman, but it can cause lots of symptoms in a man, okay? And vice versa. So we'll kind of I'll kind of point those out to you. Okay, the first one I want to talk about is gonorrhea. This is caused by Neisseria gonorrhoeae. It's a gram-negative diplococcus. So this arrangement and shape is often used as a way to identify the bacteria. So here you can see the bacteria, right? So this is what the bacteria looks like. And these are white blood cells. You often find white blood cells when there's an infection involved. Okay, right? That's why you may hear about like, what's the white blood cell count, right? To tell you there's an infection. Now this is an STD. Where did they get the sample from? Yeah. So where they get it from? So it's from discharge, right? So it's from discharge from either the penis or the vagina. Okay, so and that's one of the symptoms of this disease, right? So let me go through this. The way it infects is that it needs to get into the genitals. So it has fimbriae, which allows it to attach. So this is how it gets into the urethra, and then it spreads from there. Something else, so these bacteria, they like moist surfaces, right? So because of that, so besides being sexually transmitted, another moist surface is your eyes. Okay, so they often can cause eye infections. And there are other parts of the body too that could be infected. If you're looking for something that has characteristics of being moist, like the sexual organs or the eyes. Okay. Now, in the male, this causes inflammation in the urethra. It causes pain, urination, and discharge. So these are some symptoms that you're going to see a lot with these STDs. It can also spread to the prostate gland and testes, and that's where it causes more serious complications. One thing I want to show is, so just to give you a difference here, in the female, it's usually asymptomatic or mild. So this is a case where in the male, you often have symptoms, but in the female, you may not have as many symptoms. However, when it does cause symptoms, you have painful urination and vaginal discharge. There is a common condition with STDs called PID, pelvic inflammatory disease. That's actually pretty serious because that can lead to ectopic pregnancies. It can also lead to sterility. Okay? So this is the connection how STDs can cause sterility. Okay? one reason why STDs are a problem is that there are many examples where the symptoms are mild or asymptomatic. And so in terms of controlling the disease, that's a problem because someone may be infected and can actually spread the disease, especially if they're sexually active, and not know that they're spreading the disease. This gives you, so one thing that epidemiologists like to follow is what are the, what's the incidence rate? Okay, so if I say incidence, we're referring to what? New cases of disease, right? And so it's interesting to see the gonorrhea illustrates some of the patterns of the disease that we see with STDs. So if you notice, there's a peak here. Do you know why? End of the war, okay? So, right, and then also you notice there's a peak here, actually quite an impressive peak there. And so why is that? Yeah, so now this is probably for a lot of you, this is like too far long ago, but in the 60s, right, that was quite a time when you could see there was more sexual activity, right, during the 60s, right? So
free love.
Free love, yeah, it was an era of free love, right? That's when we were last able to send people to the moon, okay, because we were in that kind of mindset, all right? And so, okay. Then along came Reagan and so forth, and things went down, all right? So,
And then love cost you.
yeah.
It cost you.
All right? Okay, so now I mentioned that eyes can get infected. So there is a condition from gonorrhea called ophthalmia neonatorum. So this is also known as newborn conjunctivitis. Okay? So how do babies get it? When they go through the birth canal, right? So the mother's infected with gonorrhea. The baby goes to the birth canal. The eyes get exposed, and that can cause conjunctivitis. And why that's an issue is that can lead to blindness. Okay, so it can lead to newborn blindness. So the way that we prevent this, the way that we keep this from happening, is that you give the infant, you give the newborn eye drops. Those eye drops have antibiotic in it. Okay, so that explains why when the baby comes out, that's why they get those eye drops to prevent these kind of conditions. Okay. Now, STDs, you can treat these with antibiotics. Okay? So even that syphilis outbreak that I mentioned in the early part of the unit. So remember we went through the ELISA test, and I showed you that graph of all the that network, how the disease spread. Okay? The way they treated that was with penicillin, right? So you can treat these with antibiotics. It's a matter of just getting the treatment. Okay, here's another. This is the second one. This is chlamydia. This is actually one that we hear a lot about in the United States. It's caused by Chlamydia trachomatis. This is an obligated intracellular bacteria. It actually has to live inside cells, our cells. And this one, what's special about this particular disease is that when women get infected, most of them, in fact, a large majority of them are asymptomatic. Right? This is a case where you see differences in how females are affected versus how males are affected. However, there are some, when it does cause symptoms, there are some conditions that actually have to get reported to public health officials. So these are notifiable conditions. One is called NGU, which stands for familial non-gonococcal urethritis. Okay. This is inflammation of the urethra. And then in males, there's another condition called LGV, which is lymphogranuloma venereum. This is when the lymph nodes near the groin area get inflamed. Right? So it produces these bulges right around the groin area. Okay? Now, the reason why they call this non-gonococcal, because it's not gonorrhea. However, the symptoms are often similar to gonorrhea. Right? So, because they use this name, it shows you how similar these symptoms can be. So, you have like urethritis, pain on urination, discharge. Those are sort of symptoms that are common to STDs. If you were to go onto the MMWR, like you go to the CDC site, and you look under the Morbidity and Mortality Weekly Report, and you look at their statistics, you'll actually see a section for STDs, and you can get a report on the number of NGU cases and the number of LGV cases. Okay, so that's something that they actually keep track of. All right, so with females, you have urethritis. PID is another common condition. Okay. Ectopic pregnancy and sterility. So again, we see some common conditions here. Also, it can cause conjunctivitis in newborn. Also cause pneumonia. And just like gonorrhea, we treat this with antibiotics. What's interesting is what's also interesting is the epidemiology. So this is data which looks at age groups. Okay, so this tells you the female population, the male population on the left, right? So if you look at this, which age group tends to be more infected?
15 to 25.
Yeah, so this is the age group that you find in college often, right? So this is why you may hear about this disease associated with colleges, okay? Because it tends to be more prominent in the younger population. Right? Also, they find a lot more cases in women than men. Okay? So that's why especially at four-year institutions, you hear about, you may hear word about how they have these special clinics and special services, and it's because of this issue. Any questions about that?
The obligate intercellular part, it can't reproduce without a host.
Yeah, that's right. It has to live inside that host cell. Yeah. All right. Any questions about this? Yes.
So those two things that you said are reportable, NGU and LGV.
Yeah.
Those are the only things if you get to that degree of symptoms. Like if you found out you had chlamydia but you're asymptomatic, you would not have to report it.
No, that would be reported too. But
It would?
But they also report. They also report specifically the LGV because those are more serious complications.
Oh, okay. But whoever's diagnosing it will have to report it.
I think, yeah, I'm pretty sure they have to report. They have to report chlamydia. So.
And I just wonder why more women have it if they don't. If 85% are asymptomatic, why are more women showing up as having it as opposed to men, where you think men, because they show symptoms, they would have